Got it. So, hi everyone. It's so great to be with you again here on another Wednesday evening for a wellness workshop. So, I'm Kiyomi and I'm with Center of Life. And then we also have the awesome Devon on here.
Hello, everyone.
And we're really excited today to be able to bring you Betty Braxter with the University of Pittsburgh School of Nursing. We're going to talk about career opportunities in the medical field, which we all know right now the job market is just popping. So there's lots of opportunities for people out there, especially, if you've been in a job and you feel like you want to change things up a little bit. Now's a great opportunity to do so. So we're really excited to be able to bring the speaker on with you. So Miss Betty, I'm going to go ahead and mute myself and give you the space, and then Devon will work the slides for you.
Okay. So good afternoon or early evening, everyone. I'm delighted to be with you. I'm Betty Braxter. I'm a nurse, and I'm with the University of Pittsburgh School of Nursing, and we're so delighted to be involved in the Hazelwood community. So this is one of many activities we will be doing with Kiyomi and Devon as we move forward with establishing our relationship. As Kiyomi said, and Devon pulled together, we're going to talk about healthcare careers and talk about what's available. And it is a perfect time if you're considering changing jobs, if you have some experiences, those may lend themselves very well to some of the health careers we're going to talk about. And it is beyond, I'll share with you, I'll spend a bit of time talking about nursing and medicine. But I want to talk about some health careers you don't hear about often, or you don't even think about, and what needs to be done. And I'm going to try to gear it to if you have grandchildren or children, or if you know someone who's trying to make the change, what are the requirements, and then look at what are the paybacks monetarily wise associated with these careers. Go ahead, Devon, just hit the next slide. And you can just hit the next slide. So this was a little icebreaker, and you can think for yourself, your children, grandchildren, nieces, nephews, or yourself. Have you been thinking about moving into the healthcare arena, or maybe your child, your grandchild, or nephew and niece has been talking about, I'm kind of interested in being X. So we're going to talk about what those X's are as we move forward. And we will also begin that conversation beyond just medicine and nursing into some other arenas, and try to give you a sense of the percent of African Americans specifically who are in these fields, and kind of wrap that up at the end. So next one, Devon. So we're going to, as we said, provide an overview on opportunities within the healthcare arena. And these opportunities are beyond the hospital. They can be in the community. We're going to talk about who are the members of the healthcare team and providing care to individuals, whether they're in the hospital or outside of the hospital. Next slide, Devon. And we have various members of the healthcare team. On one of the slides, you are almost see 15 different members of the team. And these are all occupations that are of interest, and all occupations that are open at this time. There has never been a time when there's been such a need from people in healthcare. A number of older nurses, for example, they're moving out. There are opportunities now for new nurses, or those who are even considering nursing, to begin to make their plans for moving into this arena. And the primary care of the healthcare team, as you would think, is to promote the health and well-being of individuals, individuals, families, and communities. The next slide, Devon. So here's kind of an overview of the healthcare team members, the administrator, hospital administrator, aides and assistants. They all are, and you may know an individual who is an aide or a PCT, which is a patient care technician. They're is what the term called case manager, and that's specifically as it relates to social work a lot of times. And that's one of the occupations we were going to talk about for about 2 or 3 minutes, because we have about 15 different occupations we want to share with you. Dentistry, dietitians work in hospitals, nutritionists work outside of the hospital, and talk about how that is a great career, and even working as an assistant in that arena. EKG technicians, these are the people who, if there is a problem with your heart or your lung, they monitor. And who would have thought? That's a member of the healthcare team. And we're going to talk about the requirements. Healthcare coordinator, you might hear the term health coach. It's not represented on this slide, but that's another new opportunity to become a part of the healthcare team members. Lab, people who draw your blood, they evaluate what it's telling, the lab assistant, the lab technician, all good occupations. Then there is the licensed practical nurse. Most people know about a doctor. Medical technologist, that's the individual who kind of reads the reports and gives someone like the physician guidelines. Is this normal? Is this not normal? Then we have nurse aides and assistants. We have higher level nurses. These are practitioners who actually take care of you. They manage you. They determine what medications you are to take. Similarly, the nurse clinical specialist, unlike the nurse practitioner who really has a one-to-one management piece with patients, nurse clinical specialist kind of works with nurses, talking about what's the best way of helping to care for a patient with X problem. The occupational therapist gets people ready to get back onto their activities of daily living. And hopefully by the end of this conversation we have with you, you have a kind of a familiarity with all members of the healthcare team and understand there is a place for you on the team. The next slide. Again, if you look on my right hand, you'll see a litany of careers there. Respiratory therapists help you to breathe. Again, the lab person, the phlebotomist takes your blood. Xray, the technician who's, gets you ready for the Xray. Similarly to mammograms. And if you're a female, after a certain age, you have an annual mammogram typically. And there are technicians there that place you, they do the imaging, they send it on. But that is a career in and of itself. And we're going to talk about those kind of technicians. Central supply people, CNAs are certified nursing assistants, maintenance staff. You see the nurses there, you see dietitians, you see health information management. Who do you go to about issues related to being in the hospital or the clinical the protocols? And information technology, people that, allow you to take care of when you push the button that alerts the nursing staff that you need help. All of these are careers within the healthcare arena. And some of these careers require an associate degree that sometimes you can earn within 18 months to 24 months. And even there are one or two that with certain experiences, you can have a high school degree and a GED to get you started. So we want to speak to those too. Next slide, Devon. I think we start with case managers, and these are social workers. Now, these individuals can be female or male. They work with patients and families around issues like resources. They advocate for you. They will talk with your physician or the person who's managing you. Now, a social worker can even offer therapy. They can provide counseling service. Typically, the case manager kind of coordinates and they kind of help with management and financial support for patients and clients. Now, for case managers and social workers, typically you need a degree in social work. But there are a number of colleges and universities that are local that you can apply. And I want to talk about funding at the end. There is money available. And with the pandemic, we will see and have seen an increase in funds for having people in the healthcare arena. Now, I want to specifically speak to African Americans, because I think we probably have a number of Black and African American individuals that will be looking at the video, and people who look like me, and talk about percentages. We've talked, and you have seen in the media, the need to diversify the healthcare arena. Right now, you're seeing a percentage that says about 22%, 1 out of 5 individuals who are Black are social workers. And these social workers are working with, in many neighborhoods, primarily Black population. Now, when we look at maybe senior level social workers, case managers, the percentage is even lower. It's about 13 to 17%. Look at the annual salary. This is about $3,000 to $4,000 per month on average. Now, these are national salaries. Could be higher in some areas, could be slightly lower in some areas, but the annual salary is not, it's sufficient for most beginning individuals. And as you increase in seniority, the salary does increase. Something that if you have children or grandchildren, and they are talking about, I want to go into healthcare, social work, becoming a case manager is perfect for an individual who likes to work with people, likes to help people solve problems. It's a perfect opportunity. And you're working one-on-one with individuals in your own community, in community clinics. That doesn't have to be in the hospital. It can be right at in your community, providing services to members of the community with a decent salary and insurance that goes along with that. Let's look at another career. Go ahead on, Devon. Dentistry. Most of us have to go to the dentist. Now, this is going to require more time on the part of an individual who wants to be a dentist. But the dentist, of course, all of us know good oral health. That's the primary focus of the role of the dentist. Prevention of dental and oral disease and any kind of irregularities, the dentist is going to focus on. Typically requires 4 years degree. There is kind of an admission test, and then you apply to dental school. You go through dental school, then there's a licensing. So it does require time. This is one of those that will require time, but when you're young, you have the time. And if you begin to prepare early on, there are funds available. And if you look at the percentage, less than 4% of dentists in this country are African American. And this is a 2019 statistic. And you see the annual salary, which is commensurate with the schooling, putting your practice together, but it does require time. These are the kind of careers in dentistry that will require time. But it's very doable, very doable. A number of our children and grandchildren, or even young adults, don't get into something like dentistry because they don't think they're going to be well prepared. But you can prepare yourself, and as you can take early on, if your child or grandchild is thinking about dentistry, science courses, math courses, do other things that show that you want to be at a leader of the pack of in terms of the students that in your school. It may not have advanced placement, but you can do well in your school, so that and begin to look for those kind of scholarships. Takes time. Any good thing that you want to achieve is going to take planning and time. And I know most of the people on who will be viewing this video are in our terms of our live stream know it takes effort, it takes commitment, it takes planning, it takes how am I going to fund this? Because you don't want to come out, or you don't want your child or grandchild to have XXXX amount of loans to pay back, if at all possible. The next one, Devon. Now, this is a career that is really very hot now. It's hot because we're in the middle of a pandemic. This is an infection control person, and they focus on infections. Those acquired in the hospital, those acquired outside of the hospital. Where did the infection begin? Are there clusters of infections? How does the environment play into the transmission? And then this individual can engage in education, being a consultant, work within the research field. Now, it does require a degree, but you can get a degree at a university, a college, and can be your pathway for becoming viewed as infection controlled individual. Often it works well if you're a nurse because you bring that experience in, but you don't have to be a nurse for infection control. Again, when you look at the percentage of African Americans viewed and having this occupation, it's about a little more than 12%. And you can see the annual salary, just looking within the nursing arena, is about close to $85,000 per year. Again, a degree, community college, have some, begin to share with others your interest in infection control, maybe get some classes, certification, certificates, then you could apply and become an infection control individual. This particular occupation will only gain status more and be strengthened more because of the pandemic, because of the need for having someone involved in contact tracing, knowing what to do, tracing it back to where it started in the neighborhood, in the community. And that person could be you, could be your child, or could be your grandchild. Next slide. Of course, the medical doctor, yes, and they're doing the health assessment, the management, the medication. This is very much like dentistry. It requires a longer period of time to achieve that. Becoming a doctor, undergraduate degree, then a medical education, you complete med school, licensing exam, and then on-site working with clients. When you look at the percentage of African-American doctors, this is about 2018, 2019, a little more than 5%. Some people might quibble with that, thinking it's 8 to 10%, but we don't have the percentage for African-Americans as medical doctors across the field. I've not seen any data that says it's like 15 or 20%. And you do also see the annual salary. Commitment time for any of these, sometimes the time is less than 8 years or 12 years, but there's got to be a commitment and time to any of these. All are very doable. All are very doable. Next one. This is one that we often don't think about either. Here's a medical technologist. That's the person who comes in, or the technician comes in, gets your sample. Could be blood, could be sputum, could be any kind of sample. And that medical technologist is going to look at, try to determine what the results show. And they have in place protocols that ensure, to the best of the institutions, that what they're seeing is correct. Does require a degree. You see the percent of African Americans who have the occupation of medical technologists. You also see the salaries. And for the past 5 to 7 occupations, the salaries have been $40,000 or above, and this is annual. And typically medical technologists work in hospitals, they work in laboratories, they are involved in research. So they're in a number of arenas outside of the hospital, but we often don't think about the medical technologists. Next slide. Here's a nurse, and I intentionally put on the screen an African-American male nurse. We often think of nursing, but across the board now, we have about 10% of nurses who are male, and there is a need. Most hospitals and schools of nursing, go back to the nurse, Devon, thank you, are really looking for male nurses. Can be an associate degree. There are programs here in the city where, you can get your RN degree in less than 24 months. There are a number of online programs. These are all things you got to consider. I'm always for getting the best bang for the monies that you're paying for. So you look at that, you weigh it. The move is toward the BSN degree, but many nurses have started with the associate degree, then moved to the BSN degree, and then you have to pass the licensure. You see with the percentage of African Americans, again, this may be on the lower end, around 8%. On average, the average salary, this was kind of the middle salary, but the average salary can range for like 40,000 to about 75,000 or even beyond, just depending on if you are a leader nurse in that institution. You could significantly draw a salary close to 6 figures. Just depends on where you are, and that's in a hospital setting. In an academic setting, as a nurse, you can work with students and etc. And there are always the advanced practice nurses who are actually managing. And some of you may be aware, there are certified registered nurse anesthetists who are in hospitals and other healthcare arenas who do very well salary-wise. And on average, their salary is about a 6-figure salary. Also requires time, commitment, moving on with your degree, but that can begin early on. It can begin with an associate degree. You get your RN, you're interested in nurse anesthesia, alleviating pain, working with clients, and move into the nurse anesthesia role. Next slide. These are two different careers. Nutritionist, again, works pretty much with well people, healthy eating, and there's so many different diets now. And the nutritionists are involved in that, talking with people about is diet, this plan better than another plan. These are individuals who typically have an undergraduate degree. The dietitian typically works in an acute care center, such as a hospital. They're the people who plan what you eat when you're in the hospital. And both of these occupations, salary is fairly decent, 50, 60,000, depending on where you live. And you can see these two careers have, in my review, they have the lowest percentage of African Americans here in the States. And these are like data from 2019, less than 3%. Talking about food and the implications of food to keep you healthy, what you need to eat to support your well-being. So these are two that, talking with family and friends, and they're interested in food. Everyone is interested in food. They like the foods, or they say, I don't know what this is about. Maybe a career that they might be interested in. Next slide, please. Occupational therapists are people who help others become independent following maybe an accident, an injury, some serious illness. Again, it requires for the occupational therapists, there is an assistant and a technician. We'll talk about those individuals, but the occupational therapist does require a degree from a university or college. Again, you see the percentage, around 3% are African American, and you see the salary, a very nice salary that can support a family and support a family fairly well. And you see in this picture is the occupational therapist helping the individual learn how to regain their balance and begin to walk efficiently. Next slide. A pharmacist. You think, and there, think about the pharmacist. That's a person who helps you with the medication, mixes it, packages the medication, labels the medication. Now, in the city of Pittsburgh, there are several schools of pharmacy. So you'd have to enroll in that school, move through it, and you see the percentage of African Americans who have been identified as pharmacists, and you also see the annual salary, which is a six-figure salary depending on the city in which you live. And as a pharmacist, you can work for a retail pharmacy, such as CVS, Rite Aid, and several others, or you can be your own entrepreneur and have a pharmacy yourself. So there is that opportunity, and that's very similar to a nutritionist. Nutritionists can be consultants. They can have their own business. So do nurses. So there are many opportunities associated with these particular careers. To the next slide, please. The physical therapist, unlike the, and I can see where it kind of blended in for the picture, Devon. I hope people can see it. Unlike the occupational therapist, they really are involved in getting people to move again. Now, the occupational therapist, yes, will be involved in helping you walk, but they're also involved in, helping you begin to eat better and how to move for eating. The physical therapist is going to be associated primarily with movement, reducing and managing pain associated with movement, and restoring the abilities to move well and the prevention of disabilities. Again, degree from a university or college offering a physical therapy program. You see the percent of African Americans, about 5%. And you also see the annual salary, which is pretty decent. Across the country, this is the average salary. Next slide, please. Here I want to talk about, so we went through some categories of occupations, but there are other occupations also that are associated with dentistry, pharmacy, physical therapy, and occupational therapy. Unlike the previous, full occupation, some of these do not require 4 years of college, 8 years of college, 12 years of college or university. For example, most of us, when we go to see a dentist, the person who is going to develop the molds and operate the equipment and the monitors or assist the dentist is the dental assistant. As a dental assistant, you can become that assistant through a vocational school or community college. You are seeing the percentage of Black African Americans who are dental assistants, and you also are seeing the annual salary. Now, this is a person who's helping the dentist, and all of us have seen those individuals with, as a dental assistant, they are typically housed within institutions, clinics, hospitals, dentistry schools that provide these perks, and the perk being like insurance. So this is another occupation that is open and is, needs to be diversified as the other occupations, that is very doable and doesn't take as long a time as some of the others. Occupational therapist assistant. It's going to monitor the patient's progress. Remember, the occupational therapist is going to get you up, get back to doing activities of daily living, eating, walking, those kind of things. The therapist is going to monitor that progress, kind of work with the patient more one-on-one, teach patients with disabilities to become independent, more independent, and continue to, unlike the occupational therapist, a lot of the focus is on maintaining the records, patient records, and keeps the office in good order, and keeps the treatment room and equipment in good order. Associate degree, which means community college, 2 to 3 years in that setting. You see the percentage is quite low for African Americans, but the salary is very decent. And you may not think of an occupational therapist assistant. Next slide, another assistant. Physical therapist. Now that person will work, physical therapist assistant will work with a physical therapist, but will treat the patient through exercise, massage, and gait training. Again, associate degree that's possible within an 18-month period of time. You see the percentage of African Americans. You also see the salary. We have not had a salary base lower than $40,000. Here is a pharmacy assistant. So you have the pharmacist, then you have the pharmacy assistant. They assist the pharmacist with selling and preparing medications to patients, typically in a retail pharmacy drugstore, such as CVS, as Rite Aid. Sometimes the pharmacy assistant can be a high school graduate with experiences within retail or GED with work experience. You see the percentage of African Americans who serve as pharmacy assistants. You also see the annual salary. Again, no salary under $40,000. Then the requirements typically range from high school through many years postgraduate. So you have a spectrum of requirements in terms of educational requirements. Next slide. Here are technicians. These are people we see all the time in the hospitals, all the time in the clinics. We go to them for annual tests. The EKG technician, again, test heart and lungs. Associate degree could be from a community college, may require 3 years, 4 years, or a bachelor degree, or a certificate. You see the percentage? You see right around close to 40,000 for a technician. Again, typically technicians work in these institutions where insurance is a part of it. Lab technician, set up, test, maintain lab equipment, prepares a specimen for looking like a blood specimen, a urine specimen. That individual prepares that. Associate degree, 2 to 3 years, it could be a certificate. You see also the percentage, around 12%. Again, annual salary, slightly more than 50,000, including insurance. Next slide. Now the X-ray technician, this is kind of like the mammogram individual, records X-ray images. If you get a mammogram, you see that person go behind a little kind of screen and they're looking at the images, positioning you, maintaining that, the person maintains that equipment and manages X-ray exposure. They put something over you when you're involved in X-rays. Associate or bachelor's degree, you see the percentage of African Americans. You also see typical salary for these technicians. Next slide, as I'm coming kind of to an end and just want to talk with you in general. Often the conversation turns to, well, that's great, Betty, and I can understand the time commitment. I can also see, okay, I'm changing my career. I could invest 18 months, but who's going to fund it? What are agencies, what are organizations I can go to actually help me to get through some of these maybe educational requirements. There are scholarships, there are stipends. If you are younger and this is like your undergrad, you're coming out of high school, there's student work opportunities. Do not let anyone share with you that there is not money. It's just finding where those pots of monies are. Every college and every university, irrespective if it's private or not private, they offer scholarships, they offer stipends, they have student work opportunities. When we talk about nutrition and dietitians, there's the Academy of Nutrition and Dietetics. That academy offers scholarship and funding opportunities. Remember, nutritionists and dietitians, less than 3% are African American. There are public health scholarships for when we talk about, public health opportunities. These are federal scholarships. Sometimes they do require you to receive the funds and then to give back, which means you're working in that arena, but you're getting paid when you're working. There is the American Foundations for Pharmaceutical Education, another organization that provides funds for individuals interested in becoming a pharmacist. American Occupational Therapy Foundation, another organization that provides funds and can link you to other organizations to provide funds if you wish to become an occupational therapist. Similarly, for physical therapy, there is the American Medical Association. There is the National Black Nurses Association and the National Medical Fellowship. If your focus is nursing and medicine, there are monies for you. If you are interested in any of these occupations, being an EKG technician, being a pharmacy assistant, there are monies. It does take commitment and time. And if you are of a certain age, you're in your 20s or late teens, you know how to Google search. You know how to get on the computer. Yes, you may spend days trying to find the money, but once you get into the occupation, think of what you can do to give back to the community, support your own family with these occupations. So next slide. And I think I'm coming to the end. So I want to summarize, and then I want to talk to the parents and the grandparents about some of these occupations. So there are those occupations for your child and for your grandchild to be a member of the healthcare team. If there was ever a time that we have an opportunity to truly more diversify the healthcare team, it is now. It's the result of actions that happened last summer. It is the result of the pandemic that exposed the inequalities and the diversity that we have in healthcare. It is time now. So if your grandson or if your child is interested in math, please promote that. If they're interested in science, please promote that. If they're interested, if they have a curious mind, continue to support that, because those are the attributes of individuals in the healthcare team. So educational requirements can range from, as we saw with the pharmaceutical assistant working in retail, can range from a GED to post-graduation. It may not be, and you may not be suited. You may find yourself saying, I don't want to be a doctor. I don't care if they make $300,000 a year. That's not where I want to be. I want to be working more in a retail environment. Pharmaceutical assistant, pharmacy assistant. In all of these occupations, the closest we've had to 30% is with case managers and social work. In terms of African American, that percentage was like 22%. Again, I can't stress enough, the funding is available. Yes, it will take time to look through everything, and sometimes it doesn't. Sometimes things emerge, but often it does take some work on what is available and what are the requirements for me to get the funds. In terms of public health, there is the tremendous opportunity through the public health various entities to be funded, give back, covering the cost of the funding by working in the community. And when you're working in the community, you're being paid, but you're giving back in service. So there's always that opportunity. Next slide, Devon. I think, it just shows where I got a lot of the information about these various occupations, particularly as it relates to requirements, as it relates to what are the percentages, and as relates to annual salary. And Zippia careers, the data typically that I've shared with you is typically 2020, 2019, 2020. So there hasn't been significant changes pretty much within a year and a half because we've had the pandemic. I think that ends, Devon, but I just want to speak for maybe 3 or 4 minutes to the grandparents and the parents on the line, or if you're considering making a change in your career. It is a good time. People are talking about the year of resignations. People are looking at, do I really want to stay in the occupation I have? Can I do better? We have seen a tremendous change in nursing, just as the occupation I know best. I think other occupations, careers are similar, that some options that we're offering now, I have never seen those being offered before. Come in for 4 hours, come in for 6 hours. Let's change your assignment because of the year of resignations. This is an opportunity for, if you're thinking of going in these careers, to consider it, and consider it strongly, because right now we have students, not only from the University of Pittsburgh, students from all nursing schools, actually being hired in their senior year. They're not even waiting to hire them after they graduate. They're coming in, signing you up now. And we have rarely seen that in the past. So this is the time, but with that commitment, grandparents and parents, there's going to be some things that the family will need to do, not financially. You need to be aware that maybe going and having dinner every Sunday evening together may not be so supportable for that student who's trying to study for the big exam. So I think families have to realize, and I've never met a family, maybe some of you know, a family who hasn't been faced with trauma who will say, I don't want the best for my child. I haven't met that person. Maybe you have, and I'm okay with that. But when you think of these careers, then there's going to be some attention that we have to pay to the person who's going into the career is going to have to devote some time to enter into the program, to stay into the program, and to achieve the goal. Most families recognize that's needed. We just so that you recognize that it's going to be needed, that sometimes the family has to change a bit in order to achieve that goal. And as others have shared, once you get that first child through, that first child paves the way for other subsequent children. But you need to know that, and many universities and colleges are not only preparing, they always talk about our first generation. Well, this is the first generation. That doesn't mean the person won't be successful. It just means that that family has finally had an opportunity to achieve something that other families throughout the generations have achieved. So families have to mature just like the student. No one has gone to college and hasn't made a change. No one has. So your child has the success rate of achieving their goal just like anybody else, irrespective of where you came from. Doesn't matter. If that is the goal and the goal of the family, you figure that out. That person figures it out and they're successful. So when, should it be, your counselor says, well, we don't have advanced placement, not going to stop me. Well, we don't have this, not going to stop me. I'm going to figure that out. I know how to Google search. I know how to navigate. I know how to do that. My family is okay with me, stepping away and not being a part of this to give me time to study, because it is going to take time. So we can think about all the ones who say you can't do it. And there's always going to be people. You always yourself will say, oh, I'm not so sure. But then there's the opportunity was try it. That's what everybody else did. Everyone else started. Their lineage may be much more flowery than yours, but there was somebody in that family who started it. And even though they may be billionaires now, if you face the tramp, unless you're the queen or somebody like that, you face that back, somebody had to get this going. And often the person who got it going didn't have XYZ, QRX. They didn't have that. But they had, as your family is, they had the support of the family that with that goal, with the understanding, and even if it's not in healthcare, if that is a goal and you're comfortable with it, then why not try it? And don't let the name of the institution deter you from walking through the door. Because once you walk through the door, there are other people there that can be very helpful to you and to your family also. So I hope, you got something from it. Maybe some careers that you weren't thinking about, because people don't think about X-ray technicians, EKG technicians. First thing is nurses, doctors, which is great. Love for you to come into my arena, but that may not be what you want to be. And there are other arenas that you can really contribute greatly to the community. And by being an X-ray technician, being a physical therapist, being a social worker, as a social work colleague said, it may not be the sexiest title like Dr. So-and-so, but you're making a major contribution because maybe you're keeping families together as a social worker. Whereas a physician colleague, that's not their focus. Their focus is on that disease. So if you love working with people, healthcare arena, you have the curiosity, you have the goal, it is doable. It is very doable. And you don't have to have a 4.0 to get it done. Because there are people who've gone to med school who are viewed as brilliant. Couldn't pass GRE, couldn't pass SAT, but they're in those careers and doing quite well. So we hope as School of Nursing to get to know the Hazelwood community a little more. I will tell you, I'm not going to be out in your community in the wintertime because I don't go many places when it starts snowing and, oh, please, this sleet is just too much for me. But within my colleagues from Pittsburgh, they may be coming in and they said, Betty said hi, but not unless it's a good day and it's 50-ish. Not going to be around pretty much in the winter, but later spring, like we did this summer, it was really fun coming out to your community and seeing all the good things that are happening. If you are interested in nursing, are interested in healthcare careers, please give us a call. We'd be glad to help you walk through the door because we are one of the 6 schools of the health sciences. The other schools are medicine, dentistry, physical therapy, occupational therapy, social work, and public health. So we'd be delighted, even although you may not be interested in nursing, you might use as a link to those other schools. And in our forming relationship with Hazelwood community, we'd be glad to serve as a link, not only to nursing, but a link to the other schools. Because the other healthcare schools are interested in getting good students, diverse students, so that we can meet the needs of individuals. We have some healthcare needs in this country, so we need everyone to be at the table. So your contribution would be significant in terms of helping meet our needs. I know within the maternal health arena, we sure have some needs. I can't speak for other arenas, but I definitely can speak for my arena. It's too bad we don't have a one-to-one, because it'd be interesting to see what your questions might be, but this is okay too. So at some point, we may be able to get together in person and do something else. Devon, Kiyomi, that's all. But it's been fun to be with you. You guys have the slides. Devon and Kiyomi have my contact information if more information is needed. And Devon, we'll think about bringing high school students into our lab, or even doing a remote kind of view of our lab. We have done that for 2 other organizations. And it was interesting what students, even in the remote sense, we kind of showed them the skills lab and what students do, nursing students do, medical students do before they really come into a hospital setting to practice on real live individuals. And it was, the 2 groups had a lot of fun with that. They asked great questions. So that is something we could think about, particularly for the summer as you're developing your program, to do something remote. Because I'm not sure when we're ever going to get back to bringing people on campus without going through this kind of regulation and all of, paperwork. So we did a live feed, just touring the skills lab remotely, and that seemed to work fairly well. Students ask good questions, so I think we can do that for Hazelwood also. All right. I don't know, what do you guys do? You stop the recording, or what do you do? I've not done this before.
No, it's totally okay. Yeah, we're still live. We did have a couple people join us, so thank you so much for that and being okay with that option. We do have people at home. It's a little easier to join on Facebook than it is navigating Zoom sometimes. So having a tour of the labs sounds incredibly fascinating. So I think that that's a really great option for our community. While we're sad we won't see you in some mittens and with your snow sled on Hazelwood Avenue.
Oh no, not
we'll look forward to seeing you in the spring.
No, I mean, unless it's like 50-ish, it's like, And sometimes you do have that here in Pittsburgh. It's rare, but that maybe on a day when it's 50, I'll total out, but not on a day when it's snowing. And I have my ice trackers ready to go. I do. And I don't play around with the snow and the sleet. It's like, that's not a part of my DNA. I'm just here in your community for that, but not a part of my DNA. Yeah. So yeah, we'll get together and we'll be together remotely. If there are other activities you can think about, because we want the community to drive what we do.
Yes.
Now, there will be times when we come to you with an idea, but we want you to tell us we need such and such, or not need, we want to be a part of such and such, so that we can be partners. So by the time the new building comes through, there is that partnership. And when some of us are in the new building, your neighbors are not saying, who are they and why are they here?
Right. Yeah. No, we definitely appreciate
that now. It doesn't take any money to do that.
Yes.
Yeah. So for everybody that's listening, back at home or in your cars or wherever you're joining us, certainly if you have any ideas of things that you would like to learn more about, or other partnerships, or just things that you would like to see more of in the community that maybe Miss Betty can connect us with and bring to us, please feel free to, you can put that in the chat, you can email that to us. We will share Betty's contact information. We'd love to hear more ideas of things that we can bring to all of you.
Mhm.
Yes, thank you so much,
Oh,
Betty.
thank you,
It was
Kiyomi and
great.
Yvonne.
It was
It-
great. And I learned a lot of things I didn't even think about.
Yeah,
And
you
thank
don't.
you for sharing the information on, that was the first thing that popped in my mind was, how am I going to pay for this? So you covered everything. So thank you. I did want to ask, is it okay to share those slides if anyone
Oh,
needs
sure.
more?
I mean, there's nothing on that slide that, no, I think the more people become more conversant with them, people always, well, nurses and doctors, yes, that's true, but there are other things that, your other occupations that are contribute significantly and are good salaries that you can think about too and offer to your children also. Like the friend said, it may not be as sexy as medicine, but who wants sexiness? You want how you're going to contribute.
Right.
Not saying
Right.
that, and I'm maternal child, but I mean, sexiness as a part, but that's not in this arena. You want, what are your contributions and how do you give back to the community? How do you take care of your own family?
Yes.
And all of these occupations, you can do that.
Mhm. Well, we thank you for coming on, and of
Oh,
course
sure.
we're collaborating more. And thank you everyone who joined, whether it was Zoom or through Facebook. And of course, as Kiyomi stated before, this will be up. So if you didn't get a chance to watch it tonight, you can always come back and watch it again with us.
Yeah,
Okay.
thank you so much.
Okay, let
Thank
me know.
you.
That's
Yeah.
our mission.
Yes, yes. Everyone have a good night. Thank
Okay.
you, Kiyomi. Thank you, everyone.
Thank you all. Thank you.
Bye-bye.
Bye-bye.